Today is June 15, 2013, Saturday, 10:58 p.m. Pacific Time. And up next, facial palsy and gluten sensitivity. A connection is found. A recent paper published in the Journal of Neurology, Neurosurgery and Psychiatry discusses a strong connection in patients with facial palsy induced by gluten. Recurrent peripheral facial paralysis, or PFP, is an uncommon disorder that often occurs in the setting of family history. In 2001, we observed a patient with recurrent PFP who manifested symptoms of coeliac disease several months later. Because of this observation, and because neurological disorders may be the only manifestation of atypical forms of CD. And this is the study source right here. What is facial palsy? Facial palsy is a disorder characterized by paralysis of muscles in the face. It can be caused by a herpes virus and is sometimes caused as a result of inner ear infections. New research links gluten intolerance to this neurological disorder. So if you have an ear infection, beware, folks. Gluten sensitivity and nerve damage. There are numerous studies linking gluten intolerance issues with damage to the nervous system. Some doctors believe that the primary way that this protein induces damage is through the nerves. And here are the doctors and what they say. Dr. Charles Parker says, a psychiatrist has great experience with gluten damaging brain tissue. Dr. John Simes, a veterinarian, has discovered a connection between gluten intolerance and epilepsy in dogs and cats. And this doctor, which I'm going to try to say his name, Haji Vasilio, has discovered a link between gluten and multiple neurological diseases, including cerebral ataxia, nerve pain, numbness and tingling, dizziness, and more. Gluten can also contribute to neurological problems by inducing nutritional deficiencies. And here's a video that you can play: gluten intolerance, nerve damage, and B vitamins. Alright, and that's 2 minutes and 34 seconds long. And I'm just going to try to give you a link to this video. Resolution of nerve disease on a gluten-free diet. Many patients experience a complete resolution of nervous system symptoms after going on a gluten-free diet. I have personally seen the following conditions improve or resolve in my Houston clinic: migraine headaches, nerve entrapment syndrome, carpal tunnel disease, and cervico-brachial syndrome, chronic nerve pain, neuropathy, bipolar disease, schizophrenia, ADD or ADHD, autism, vertigo, epilepsy. Although gluten is not a catch-all for people with nerve disease, it is a known neurological toxin, and intolerance sensitivity should be ruled out in patients immediately. Other common environmental factors that can contribute to neurological symptoms and nerve damage include the following: aspartame, NutraSweet, caffeine, chemical pesticides, fungicides, and herbicides commonly sprayed on non-organic produce, mercury exposure present in some vaccines, and lead exposure, cadmium exposure, aluminum exposure excessive. Well, I would say that covers chemtrails, doesn't it? B vitamin deficiency states, especially vitamins B1, B12, B6, B3, and folate. Okay, and here's some information if you're interested. And I'm not offering any medical advice, folks, in this video. I'm just offering the information. If you have a medical condition, please see your own doctor, okay? But this might help you with more further research if you think you might have a gluten sensitivity issue. These are pretty serious symptoms, right? Facial palsy and nerve damage. Those are really serious. And also what was listed in this list of problems here. These are very serious problems. Look at this: bipolar, schizophrenia, chronic nerve pain, autism, vertigo, epilepsy. Those are all serious issues. Unfortunately, a lot of us have been eating gluten for most of our lives, I would bet. Some people maybe not, but I would think a lot of people have been. We're just now finding out about the gluten sensitivity and about the GMOs in the grains. Yeah. Okay, folks, do your own research too if you need more info. Thank you for watching. Please stay safe. Pink out.